Last week I made a special appeal directly to those living and working in Dublin. This week I want to speak again to Dubliners, but unfortunately the situation is also deteriorating in several other counties, so this is a message for everyone all across the country. The number of positive cases and the positivity rate, which is the proportion of people with a positive test, is going up. The virus is on the increase. This is why I'm appealing to everyone to decrease your social contacts by half for the coming weeks. I'd like to give you some background to this, to show you the why behind what I know is a very big ask for people. Case numbers are growing exponentially. They are likely to double every 10 to 14 days if every one of us does not immediately act to break chains of transmission of this virus. There have been over 1,500 cases in Dublin alone in the last fortnight. This is more than half of the cases being reported in the country, and the worrying increase in hospitalisations are also being concentrated in Dublin. However, the picture nationally is also disimproving, and some other counties are seeing concerning trends and turning red, particularly Louth with 118 cases in the last 14 days, Limerick with 110 cases, Waterford with 94 cases. A large outbreak is also being dealt with in Offaly, and case numbers remain high in Kildare. I am asking people in all these counties to pay particular care and to try to cut their contacts in every way possible over the coming days. As cases have continued to rise, people are getting sicker with COVID-19. The number of people in hospital has increased, with 79 people in hospital this morning. To put this in context, there were just 22 people in our hospitals 1 month ago. In addition, older people are catching this disease. In August, there were 178 cases in people aged 65 years and over. So far this month, there have already been 331 cases in this age group. In the entire month of August, 4 people died with COVID-19, but already in September, there have sadly been 15 deaths. This is a serious concern. Every death is a tragedy for those families involved. If the level of virus in our communities continues to increase, we will face grave difficulty in protecting our most vulnerable, and unfortunately the morbidity and mortality associated with COVID-19 will increase. To be clear, we must not go back to where we were nationally in April. So how is the situation in Dublin different to what we saw in August in Kildare, Laois and Offaly? Well, that situation was linked to outbreaks in known workplaces that we needed to contain in order to bring them under control. This shows that the situation in Kildare, Laois and Offaly took off extremely quickly over a matter of days, and we know that the outbreak started in workplaces, the first grey peak, and then moved into households, which is the second grey peak. The behaviour of the disease is different in Dublin. The rise in cases is not linked to specific workplaces or specific parts of the capital. It is being seen all across the city and county. People are catching this virus as they go about their daily lives, meeting socially, interacting in their communities and in their workplaces, and they are bringing it back to their homes, where it then spreads within and between households. The R0 is currently between 1.3 and 1.7. Our models tell us that if we do not act now to stop this virus, we could have upwards of 1,000 cases per day by the middle of October. But it does not have to be this way. If we all cut our social contacts by half, we will cut the R0, the reproductive rate of this virus, by half. The lower our contacts, the less chance this virus will have to spread. So I'm asking you to prioritise who you need to see. See half the number of people this week that you saw last week. If we all cut our contacts to those we really need and want to see, we limit this virus's potential to move from person to person, and we protect ourselves and each other. When you do meet people, keep your distance from them at all times. Work from home if you can. Avoid crowded places. Don't drop your guard. Use your judgment, risk assess each place you go, and leave if you think it's unsafe. If you have any symptoms you are concerned about, isolate yourself, contact your GP, and see if you need a test. And remember that the consultation and the test will always be free. And also remember that this virus transmits from those with no symptoms at all, and so you should act at all times as if you have it, to protect those you love from catching it. While the solution is simple on the surface, I know this is hard. I know we are all fed up of this pandemic and we all want normal life to return. But it is precisely this set of emotions that COVID-19 will thrive upon. Each time we meet, we are giving this virus an opportunity to spread. This opportunity leads to a chain of transmission that may well end up with a person in hospital, in critical care, or dead. I appreciate every individual action and daily decision that you are making to keep yourself and your family safe. It is these individual actions that stack up to something powerful on a collective level. Together, every safe behaviour counts. So keep at it. We can do this. Thank you sincerely for listening and for all that you are doing. And stay well this weekend.